Okay, and welcome back to Stephanie's Infomercials. For this segment of the show, we'll be talking about the trail making test, parts A and B. You as an audience may be wondering, what exactly is the trail making test? Well, the trail making test was created in 1944 and is a neuropsychological test of visual attention and task switching. It consists of two parts in which the subject is instructed to connect a set of 25 dots as fast as possible while still maintaining accuracy. The trail making test is an evaluation tool that is used to screen individuals with dementia, brain damage, and brain injury to assess cognition, the ability to think, reason, and remember. So to discuss the trail making test a little bit further, we have with us expert occupational therapist Katie Anderson.
Hi there, Stephanie.
Hi, it's great to meet you.
It's great to meet you too. So can you kind of explain to me what the purpose of this test is?
Sure. The purpose of the trail making test is to assess cognition, the ability to think, reason, and remember. And it can provide you with information about visual search, speed, scanning, speed of processing, mental flexibility, and executive functioning.
Wonderful. That sounds like something I would really like to get for my clients.
Excellent. Okay, Katie, so I think that you would get a better understanding of the trail making test if I actually administered it to you.
Yeah, I really think so too. I want to make sure that I know this test really well before I give it to any of my clients. So I think that's a really good idea, Stephanie.
Okay, so what I'm going to do is I'm going to give you a copy of the trail making test, which I have right here. And I'm going to hand that to you, and you already have a pen, but you would give your patient a pen.
Okay.
Okay? And this is what Part A looks like. Okay, so what you're going to do, Katie, is go in chronological order, connecting the dots. And so you would go like this, and then you would time it.
Okay. So it is kind of like making a trail then.
Yes, like making a trail.
Wonderful. Hence the name trail making test.
Okay, so what I'm going to do is I'm going to have you open up to Trail Making Test Part A, and let's just give our viewers at home a little glimpse. And I want you just to connect the dots with the numbers in chronological order as fast as you can, and I'm going to time you on my iPhone.
Wonderful. So I just connect from 1 to 25. So there's only 25 numbers that
Yes.
connect. Okay.
1 through 25. Okay, Katie, great job.
Thank you.
And now that you are done with Part A, I would look at my time and I would write down how long it took you to complete the task.
Wonderful.
We don't have time to complete Part B of the trail making test.
Okay.
But I just want to explain to you so that you have an understanding of what it is.
Okay, wonderful.
So in Part A, you connected the dots 1 through 25 in chronological order.
I did.
Okay, and in Part B, you're going to connect dots 1 through 13, and dots and letters A through L.
Oh wow, so that kind of adds in a little bit of a harder factor for the clients then.
Yes, absolutely. And what the client would do is connect 1A, 2B, 3C in that order.
Oh wow, okay.
So there is a lot of thinking involved in this one.
Okay.
And you still are going as quick as you can.
Okay.
And you're timing your patient. And that's pretty much it. Do we want to show our viewers at home a little sneak peek of what Part B looks like?
Absolutely.
Okay.
Thank you, Stephanie.
Yep.
Okay, Stephanie, well, I do have a couple questions after you have administered the test. So from what I kind of noticed and, from what I've learned in school about occupational therapy, it's really important to have a very good setting when you're giving an assessment. So that's something that I'm really looking for in a test. I want to make sure that I can give the adequate setting for my clients. So I've observed that I'm sitting on a table with a chair and it's a really well-lit room and I have no really distractions. Is that something that you suggest when giving this test?
Absolutely. Everything that you just named, Katie, is important for the test, and what's most important is that it's free of distractions.
Okay.
You want to make sure that your patient is able to perform at their optimal level.
Okay, wonderful. Thank you.
Okay, so now we're going to talk about some of the psychometric properties of the trail making test. And
well, actually, Stephanie, I did want to mention that I did come kind of prepared today for this infomercial because in occupational therapy, evidence-based practice is something that we really, really pride ourselves on. So if you don't mind, I can kind of share some things I found in the literature about the psychometric properties.
Please, go for it, Katie.
Wonderful. Okay, so for standardization, I did find in the literature that the trail making test does have consistent procedures that are standardized across all settings and context. So that's really important. I did see that when you are given an assessment tool that it does have the same standard procedures. So that would be like when you gave me the test and the pencil, everything is the same. So I also did find that the TMT, the trial making test, has been a valid measure for individuals with brain damage, brain injury, and dementia, and also used in a mental health setting. So it is a valid assessment tool that is given to older adults to test their visual, perceptual, and cognitive skills to drive. So this is really important for us as occupational therapists, which I found was really interesting. And also it's very reliable, and this is something that we look for in assessment tools in occupational therapy. And the TMT is a reliable assessment tool, and it has proven to have inter-rater reliability.
You occupational therapists sure do your research.
We do. So Stephanie, my biggest question for you as an occupational therapist is how can the trail making test be useful assessment and also in my OT process, and how will it impact my treatment with my clients?
This just in. We have an expert OT backstage that has handed me this,
Oh, wonderful.
talking about the usefulness of the test for OT. So if you don't mind, I'm just going to read straight from it.
Perfect. Thank you, Stephanie.
Okay, so the trail making test is useful to occupational therapists because once the OT understands the client's level of cognitive functioning, the OT can learn the visual perceptual capabilities of the client through the TMTA, so part A of the test, and also the primary working memory and secondarily task switching abilities of the client through the TMTB. Interesting. Once the OT has an understanding of all the client's abilities, they can structure appropriate intervention and treatment around these abilities.
Wonderful.
The TMT impacts treatment because it is a useful assessment during the evaluation stage of the OT process. And also, it helps to determine the future intervention sessions for the client based on their cognitive and or visual-perceptual deficits.
Oh, that sounds exactly what I'm looking for. Thanks, Stephanie.
Okay, Katie, and for our viewers at home, we just have a couple more things to touch on before we finish out our segment for the night.
Okay.
So you may wonder, where can the TMT be completed?
That's
a
really
fair
great
question.
Yeah,
Yes.
absolutely.
Settings that the TMT can be completed include clinics, schools, home settings, and hospitals. And it would be appropriate for clients with deficits in mental functioning, as we previously mentioned. So if an OT wants to assess a mental health client's current level of cognitive function, then they would use the trail making test.
Wonderful. Okay, Stephanie, well, before we finish out our segment tonight, I did want to just kind of tell you some things I've noticed about the trail making test before we finish. And I have noticed that it's very quick and easy to administer. So it didn't take us very long at all to do the test.
Not at all.
Which is great. There's no training required. It's free and it's very easy to get. Stephanie printed these off online before we started the segment today, which is great. And it's also very easy to score, and it tests specific cognitive processes. So those are some of the things that I saw tonight.
Yes, so Katie, as an OT who has administered a lot of assessments, you definitely picked up on a lot of the strengths. But I'm going to just tell you some of the weaknesses of the test because I want you and our audience to be informed.
Wonderful.
So one of the weaknesses of the test is test, retest, error. Once an individual has taken the test, he or she is pretty familiar with it and how it works, so that's something to keep in mind.
Okay.
The instructions can be confusing for certain patients or clients that you might have.
Okay.
The test can also be frustrating for individuals if they lose track of where they are and can't seem to get back on track.
So one main weakness that I saw is that the test is not very occupation based. So that's something that we look for as occupational therapists, that the test that we're giving is really relaying over to the client's occupations that they are performing in their daily life. So that's one weakness that I saw as an occupational therapist.
Okay, Katie, well, we've loved having you on our show, and you've been a great addition to my segment tonight.
Thank you, Stephanie.
I hope that you will pursue the trail making test in your future occupational therapy endeavors.
Yeah, Stephanie, this has been great, and I really think I'm going to use this on my clients, especially my clients in the mental health setting and some other clients I see that have dementia and brain damage. So I really appreciate it.
Okay, to my audience at home, I hope that you have enjoyed our segment.
Me and David, we sit out. love it so much.
Your British accent is good. Oh,